Everyone, thank you. Thank you. Beautiful day in the Rose Garden. Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action, today we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country, stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. And Bruce Greenstein, LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help, to partner with our hospitals and physicians, as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Fantastic.
Oh, we'll practice that.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest on all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward that wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit, so we're going to fill it up. There's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please. VP.
Thank you, Mr. President. It is this day should be an inspiration to every American, because thanks to your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus, we're bringing an all of America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries. And on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you put the health of America first, but you brought the best of America to address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued broad guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been in continuous contact, as you said, with governors around the country. Mr. President, you have forged a seamless partnership with every state and every territory in this country to put the health of our nation first. But today, I trust that people around the country that are looking on at this extraordinary public and private partnership to address the issue of testing with particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need. For Americans looking on, by this Sunday evening, we'll be able to give specific guidance on when the website will be available. You can go to the website, as the President said. You'll type in your symptoms and be given direction whether or not a test is indicated. And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test. And Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens. These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and Roche, have just done an incredible job stepping forward, and they're going to literally make hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together not just government resources, which all state labs can now test across the country. CDC is testing. But you said, Mr. President, that we wanted to bring all the resources of the country together, and that's what this partnership really means. The truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense, practice good hygiene, go to the CDC's website to see what the guidance is for your community or for the American people broadly. And as the President has said, it's especially important now that we look after senior citizens with chronic underlying health conditions. Last week, the President directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President. They helped us with our homework. They tucked us in at night. They cheered us on as we pursued education, cheered us on in our careers, and now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable. And Mr. President, I know I join you in saying that every American should be proud of this incredible public-private partnership that's going to be speeding access of testing to millions of Americans in the weeks ahead. And together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Thank you. Damage to our people and our country and slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus, reducing its spread and shortening the duration of the pandemic, which is what it is. The CDC has published guidelines on the coronavirus.gov to enable its coronavirus.gov, and it's very heavily used right now, I will say, to enable every American to respond to this epidemic and to protect themselves, their families, and their communities. While the risks to young and healthy Americans remains very low, we've learned a lot about this over the last 2 weeks. Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions and those who are most at risk. They have not done very well. Older Americans who are, especially if they have a health problem, they have not done well. We must take all precautions and be responsible for the actions that we take and that we see other people take. We want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, by that. That would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night my administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to. We need to be consistent in adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go. You have some hot spots throughout the world right now that people would have never thought possible. And they're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools. And we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense. For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions, and sporting events, stagger recess and lunch for schools that aren't canceled, limit in-person meetings, increase scheduled cleanings, and cancel work-sponsored travel, among numerous other steps that can be taken. Americans are the strongest and most resilient people on earth. And in the coming weeks, we will all have to make changes and sacrifices, but these short-term sacrifices will produce long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse, it could get worse. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through, in interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term. In times of hardship, the true character of America always shines through. We live in the company of the greatest heroes and the most inspiring citizens anywhere in the world. We want to take care of our people. We want to draw on the strength of our history, draw on the strength of our people, and we will get through this all together. We will just get through it. So much progress has already been made. And frankly, the numbers, because the steps that have been taken, are at a level that a lot of people are surprised, especially when you compare them with other places with far smaller populations. The spirit and the will of our nation is unbreakable. We will defeat this threat when America is tested. America rises to the occasion. And to those families and citizens who are worried and concerned for themselves and their loved ones, I want you to know that your federal government will unleash every authority, resource, and tool at its disposal to safeguard the lives and health of our people. So we're with you every step of the way. No nation is more prepared or more equipped to face down this crisis. As you know, we are rated number one in the world. We're also helping other nations. Many other nations, we're helping them a lot. And they're doing okay in some cases. In some cases, they're not doing well at all. But we're working with a lot of groups of people and a lot of other nations. With faith and heart and hope and love and determination, we will succeed, we will prevail, we will be very, very successful, and we'll learn for the future. Thank you all very much. If you have any questions.
This question is for Doctors Fauci and Birx. Dr. Fauci, based on what you currently know, what is the trajectory for when this outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx, as the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now to ramp up production of respirators and that kind of equipment should this outbreak persist?
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible to predict the time element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several weeks and then down again over other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate for me to mention it again because it answers your question. When you talk about preventing infections from without in, which is the kind of travel restrictions we're talking about, then how do you handle what you already have in your country? You continue some sort of containment, but you also do mitigation, and you try to proportion it to the areas where there are the most infections. The success of that and how much you make this turn into this is going to give you the amount of time. If we're successful, it'll be less. If we're not successful, it's going to be more. But these kind of things generally run out in a few months. Hopefully, we'll make it several weeks, 8, 9, whatever weeks. But I can't give you a number because it depends on how successful we are.
美国总统川普3月17号宣布，将会制定大规模的经济刺激计划，并可能向美国人发放现金补助，以减轻武汉肺炎对企业和民众的经济冲击。
尽管在当天的新闻简报会上，川普并没有透露具体的数字，但美国即将推出的经济援助计划规模将会相当庞大。
We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing.
据知情人士透露，川普政府的经济援助计划将高达8500亿美元，包括为航空业提供救济资金和其他经济刺激措施等。此外，为帮助在疫情冲击下收入受到影响的美国民众，川普政府还将为这些民众送出救济现金，发放对象及方式将在周二晚些时候确定。其中一些民众或会收到1000美元的支票。
That if we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly.
为遏制疫情发展，川普周一公布了新的15天全民指南，呼吁所有的美国人一同努力缓解疫情。截至美东时间周二下午4点，美国新增1254起确诊病例，全国累计确诊5917例。新唐人记者乔安综合报道。
援助企业与个人，美国8500亿疫情纾困案递交参院。美国国务卿直指中共隐瞒疫情害人害己。疫情快速扩散，欧洲各国推出纾困计划。疫情下，美国歌手开辟音乐直播。大家好，欢迎收看全球新闻。美国总统川普3月17号宣布，将会制定大规模的经济刺激计划，并可能向美国人发放现金补助，以减轻武汉肺炎对企业和民众的经济冲击。
尽管在当天的新闻简报会上，川普并没有透露具体的数字，但美国即将推出的经济援助计划规模将会相当庞大。
We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing.
据知情人士透露，川普政府的经济援助计划将高达8500亿美元，包括为航空业提供救济资金和其他经济刺激措施等。此外，为帮助在疫情冲击下收入受到影响的美国民众，川普政府还将为这些民众送出救济现金，发放对象及方式将在周二晚些时候确定。其中一些民众或会收到1000美元的支票。
That if we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly.
为遏制疫情发展，川普周一公布了新的15天全民指南，呼吁所有的美国人一同努力缓解疫情。截至美东时间周二下午4点，美国新增1254起确诊病例，全国累计确诊5917例。新唐人记者乔安综合报道。
周二，川普政府将8500亿美元的疫情经济救助方案递交联邦参议院。财长姆努钦在记者会上就方案进行了简单的说明。
Urge those Americans who can file their taxes to continue to file their taxes on April 15th, because for many Americans, you will get tax refunds. We're looking at sending checks to Americans immediately. Americans need cash now, and the president wants to get cash now. And I mean now in the next 2 weeks. I think it's clear we don't need to send people who make $1 million a year checks, okay?
除了个人所得税退税，联邦政府寄送的支票，国税局还允许在疫情期间延迟纳税。对于那些未按时纳税的个人，可延迟90天，纳税金额最多100万，无需交纳罚款和利息。而企业延迟纳税无需交纳罚款和利息的最高金额为1000万。对于之前热议的疫情期间免除工资税的说法，姆努钦表示仍在考量当中。在白宫提出的疫情期间经济补偿及刺激方案中，家庭应对疫情援助法案最受关注。3月14日，国会众议院已通过了该法案，但仍在做一些技术性的修正。参议院正等待对法案的修正版进行商议和表决。家庭应对疫情援助法案的主要内容包括：每个需要检测的人都可以获得免费的武汉肺炎病毒检测，由私人保险公司 Medicare、Medicaid 及灾难医疗系统等承担费用。少于500人的公司雇员及联邦雇员因武汉肺炎原因被要求隔离，或照顾被隔离的家人，或照顾因学校或相关机构关闭只能待在家的小孩，可享受12周的有保障休假。 前2周为无薪假期，但可以选择使用企业已提供的带薪假，比如带薪病假等。后面10周为带薪假期，薪水不少于正常薪水的2/3。不过，员工少于50人的企业不适用。此项内容涉及将近1600万美国雇员。对于失业人群，如果各州延长失业补助期，延长部分将由联邦负担支出。对老人、母婴、低收入家庭学生及依靠粮食券的人群，保证其食物供应。法案有效期至2020年12月31日。目前，参众两院正在为法案的通过而努力。参院多数党领袖麦康奈尔表示，在对家庭应对疫情援助法案表决之前，参院不会休会。新唐人记者李兰综合报道。
美国国会本周聚焦立法应对疫情。马里兰州联邦众议员戴维·特朗周二表示，国会正在讨论新一轮的救助法案，协助企业解决现金不足等困难。美国参众两院正与白宫协调推动针对武汉肺炎的第3波救助法案，协助企业应对现金不足等财务困难。
The third bill is going to deal with immediate economic relief. We need to get dollars to businesses quickly.
川普政府周二提出一项高达8500亿美元的刺激经济计划，包括减轻中小企业和航空业负担，以及向美国民众发送支票。特朗议员表示，国会正在就方案进行讨论。他也建议中小企业同步采取自救措施。
Businesses need to think about and make quick decisions sooner not later about how they conserve cash, because cash is going to be the key as this stretches on.
特朗议员强调，疫情之下，首要任务是保证民众健康，同时维持医疗、食品等必要行业正常营运。对于国会两党团结合作应对疫情，他也充满信心。
This is Team America helping each other, and hopefully out of this can come a long-term benefit that we realize we have more in common than we disagree on.
新唐人记者王凯迪，美国首都华盛顿报道。